Hello, my name is Mike, and I am doing this video journal uh, pertaining to my upcoming vertical sleeve gastrectomy or VSG surgery. Please bear with me. This is the first time I've ever done anything like this, uh, talking to myself basically. So bear with me, as I said. I am going to be kind of looking off to the side. I have some notes on things that I just want to mention. I'm going to try to keep this as short as possible, but somewhat informative. Uh, so, anywho, tomorrow I start my 2 week pre-op diet. Okay, and that basically is liquid protein, um, strained soups, that sort of thing, and that's for 2 weeks. And again, that's done for several reasons. One, kind of to shrink the liver. Okay, there's a lot of carbs and stuff built up in the liver, and the doctors would like to see the liver shrink um, over the next 2 weeks, whatever. So when it's time for the operation, the liver can be easily manipulated and moved away from the stomach, that sort of thing. So that's one reason. Another reason is they want to see that you can, you know, be responsible and go on a 2 week diet. I mean, after all, when the operation's all over, whatever, I mean, you're going to have to be disciplined enough to stick to a diet. And I guess that's really it. I chose the VSG over the lap band or the gastric bypass for a few reasons. Number one, the lap band I did not want to have adjusted every week, every 2 weeks, every month, for months, for years, whatever, and plus I didn't really want a foreign object in my body like that, where the potential of it coming apart or degrading in some manner would be cause for me to have another surgery. So I didn't want to have that. The gastric bypass seemed a little bit too invasive, a little bit too much, as far as rearranging of intestines and that sort of thing. Even though they call that the gold standard, I just didn't want to do that. So now, even though I'm having the VSG, if for some reason down the road I want to switch that, or then I can actually go and have the gastric bypass conducted, even after the VSG has already been done. So that's why I'm having the VSG. Let's see. I've seen a number of videos here on YouTube, and I would probably say most of them, maybe 80%, seem to be women. I did see I did have to kind of hunt for the ones that dealt with men, and that's only because I wanted something more to compare myself with, with other men, because obviously we differ, from women as far as maybe how much we lose, or the pain factor or whatever. So that's why I kind of selected that. So maybe this video will help you in some manner. Let's see here. You've probably seen off here, you're going to see my statistics, meaning my age, height, weight, body mass index, etc. Okay, I just posted those here, where hopefully that could be helpful to you in some manner. Also, then here I am listing my comorbidities: sleep apnea, high cholesterol, that sort of thing. So again, I'm just putting these out there just as something for you to look at, compare, contrast to. Let's see here. Again, I'm looking off to the side here because I have some notes on things I may want to just look at. I've already gone, obviously, since I'm 2 weeks from surgery. I've completed all the required appointments and seminars necessary, to get to this point. Obviously, you have to see a psychiatrist. You have some, for me anyway, for the program I'm going through. You require to see a psychiatrist. You sit down with a couple support groups. You know, ask questions, see how they're doing. There's 3 appointments
It's 2
for
o'clock.
nutritional classes, and let's see, an upper GI. Okay, is conducted. A complete blood work is conducted. If you're a certain age, you may have to have a PSA test for men, and possibly a sleep study. If you haven't already had a sleep study conducted, you might have to have one conducted to see if you have sleep apnea. I have sleep apnea, and but I did not have to have another one conducted. So, but anyway, those are things that are necessary in order to progress to the point where they schedule you for surgery. Um, from what I understand, I'll go in for surgery in the morning, and in a matter of hours, it'll be over. They'll have you up and walking around. They want you to walk, and the following day, they'll do a leak test. What they'll do is they'll have you drink some barium fluid, that chalky fluid, and put you under an X-ray machine again, and find out if you're leaking at all. If everything looks good, then you get to go home. So it shouldn't be that long a stay in the hospital, and one overnight stay, unless there are complications or something like that, and they have to go back in and kind of stitch you up a little bit better if you're leaking. Hopefully, at worst, hopefully that's the most major thing that happens is that. They send you home, and again, they recommend not to really go back to work for 2 to 3 weeks to slowly heal, and they'll give you all kinds of instructions, as far as how to bathe yourself, how to wash, how to take care of your wounds. I think really they don't have you driving for uh, probably up to 5 days without driving until you're off the pain meds and you're feeling, good enough to drive. Again, they want you to start exercising, walking, walking, walking. Okay. Um, Again, the 2 week for the program I'm in. Okay, and I'm in San Antonio. The program I'm going through, the 2 week pre-op diet is the same as the 2 week post-op diet. Okay, high protein liquids, with some other things, low fat things in there. But again, it's an all liquid diet for the first 2 weeks post-op. If everything is progressing fine, then after 2 weeks of post-op, then they'll graduate you to 2 weeks of nothing but pureed foods. Okay, low cal, low fat pureed foods. And once you progress through that for 2 weeks, then you're at stage 3, which is normal foods, but it's a new normal. It's not McDonald's. It's not this. It's not all these junk foods. Okay, so and that's kind of like in a graduated stage 2 as far as the normal foods, because they don't want you having breads and this and that right off the bat. Okay, you still need to heal on the inside for a while before you have things that might mess with the sutures or the staples. So anywho, let's see here. Calorie wise, really for the next year and a half post op, you're pretty much from 600 to 1,000 calories a day. That's it. All right, and understand, from my understanding anyway, is once the surgery is conducted, okay, your body, how do I say, what happens is the link between your stomach and your brain is disconnected. Okay, so if you're eating 1,000 calories a day, okay, you're not going to go into the starvation mode, okay, because that link has been severed, at least for a short time. And that time, what I'm hearing is usually from a year to a year and a half, that link is severed. So your metabolism isn't going to react, and your body is not going to go into this hibernation mode because you're only taking in 1,000 calories a day. So my thing is, with that being said, is take advantage of this year, year and a half. Lose the weight, exercise, learn good eating habits in that year and a half, okay? That way, when your body all of a sudden connects again, okay, which that link will reconnect, then you're going to be a normal person, meaning you're going to have to rely on eating correctly and exercising, okay, in order to maintain your new weight. And so, uh, so be aware of that. But anyway, you've got that free, 12 months to 18 months of, lose the weight, exercise, learn new eating habits, and stay with it. Um, Really, that's it right now. Like I said, I'm going to start my 2 week pre op diet tomorrow, all proteins, liquids, that sort of thing. So I'm looking forward to it. Hopefully, it won't be too painful, but it's just something I've got to do. I've got to do that in order to meet the requirements for my surgery, which would be exactly 2 weeks from tomorrow, and then we'll go from there. My next video I'll probably put out. Oh, I don't know. I'll probably put one out maybe the day before surgery, just to let you know how things went on the 2 week pre-op diet, uh, and answer any questions you might have, or maybe I'll come up think of something else to say. Anyway, that's about it. Sorry this is so long for this first one. I'll keep the next one short. Again, ask questions if you've got them. I may not have all the answers, but I'll certainly get them. So that's it. Take care. I'll see you next time.